This is the All About Hearing series from the Early Years Project. Throughout our videos, we use QR codes to direct you to different resources. In order to access a resource through a QR code, pause the video when it appears. On a different device, open the camera and point the camera at the QR code like you're taking a picture. A link should pop up. If a link does not pop up, try holding the device steady or get closer to the screen. If you need to access the QR code from the device that you are watching the video on, just take a screenshot when the QR code appears in the video. Then later on, you can go to the photo gallery, find the screenshot, tap or hold the QR code to be brought to the resource. Hearing tests versus hearing screenings. Hearing screening. This is a quick check to see if there might be a hearing problem. This is often done in hospitals, such as the newborn hearing screening, in schools, or at checkups, and the results are usually pass or refer. A hearing test is a diagnostic evaluation, detailed assessment done by an audiologist, and it measures the level of hearing loss as well as the type of loss, and it guides treatment like amplification or other intervention. Think of a hearing screening like the check engine light. It tells you that something might be off. A hearing test is the full workup from the mechanic that tells you exactly what is going on and how to fix it. Types of hearing tests. Pure tone audiometry. This is the most common test. It typically looks like or is experienced like a series of beeps at different pitches and volumes through headphones, and the participant will indicate usually by raising their hand when they hear a sound. Speech audiometry. Listening to speech at different volumes. Behavioral audiometry. This is a hearing test that relies on the reactions to sounds rather than the patient reporting that they heard a sound. There are several different styles of this, which one the audiologist uses will depend on the child's abilities, age, and audiologist preference. The auditory brainstem response, or ABR. This is where electrodes are placed on the head to measure brain activity in response to sound. Autoacoustic emissions, or OAE. This is when a tiny microphone is placed in the ear canal to measure sounds produced by the inner ear in response to clicks or tones. This test checks the functioning of the hair cells in the cochlea. Tympanometry. This checks middle ear function by using a small device to change air pressure in the ear and measuring how the eardrum moves. The ABR and the behavioral tests are most frequently used in infants and young children. There are many different types of tests that can be done to diagnose a hearing status, but only tests completed by an audiologist can diagnose or rule out a hearing difference. Parents often rely on a child's response to sounds in everyday situations as a measure of hearing ability without going to get a hearing test. While understanding how a child interacts with sounds in their environment can help gauge hearing ability in specific settings, they cannot be used in place of a professional hearing test. A child's response, or lack thereof, to everyday sounds are better used as an informal hearing screening. If there are concerns, scheduling with an audiologist may be helpful. Here is a handout of basic terms to know for an audiology appointment. The QR code here will bring you to the Early Years Resource landing page where this handout is available. One of the most important things for families to know whether a hearing loss for your child is suspected or one has been diagnosed is that you are not alone. In Illinois, you can connect with caring parent-to-parent support through our Illinois Hands and Voices Guide by Your Side GBYS program. All of this is free. These are parents who have walked a similar path and are here to listen, support, and guide you. If you have any concerns about your child's development, consider reaching out to your pediatrician, audiologist, early intervention specialist, or a developmental pediatrician for support and guidance. Even if your child passes the hearing screening, that doesn't guarantee perfect hearing for life. It's still important to keep an eye on developmental milestones and speak up if new concerns arise. Early action makes a big difference. The Early Years Project was brought to you by Illinois EDI, the Early Hearing Detection and Intervention Program, and Illinois Hands and Voices Guide by Your Side. Please take our brief survey. Parents, please access the survey using the code on the left, and providers, please access the survey using the code on the right. Thank you so much.